You've heard it said, health is wealth, so enrich your life with the Healthy Home Hour, brought to you by the Healthy Home Market. Every Sunday, 9 to 10 a.m. Know what's new and classic for health and wellness. Meet the local and national experts. Live God's plan to thrive, not just survive. I'm your host, Holly Adams, and welcome to the Healthy Home Hour. Morning and welcome. Thanks for being with us today. This Healthy Home Hour for some feasting at the buffet of health and wellness. This Thanksgiving Sunday of football and leftovers, where our buffet is offered up as a serious and very promising approach to finally feeling good. We have all suffered or know someone that suffers with chronic disease or dysfunction. Why, even though you work at it and you apply discipline and you give it your best, maybe sometimes not always, but pretty much, why do you still feel tired, weak, bloated, rashy, depressed, anxious? I mean, I know you all try, but what's missing? I mean, it can get discouraging. So our guest today, Dr. John Woodward, MD, and his team at EverVitalMD have a system, a method, approach that compares your body to you, not to millions that make up the stats of standard healthcare. It's so smart, and it's called functional medicine. But don't let the medicine part fool you. Dr. Woodward is working all the pieces of the health pie, the whole buffet, to get you well at EverVital. So, Dr. Woodward, thanks so much for joining us this holiday time today.
Thanks for having me.
Absolutely. It's a pleasure. As I was telling you before we got started, I've been trying to get you on for about a year, so I'm grateful you're here. And I know you've been busy. My goodness, your background, I just want to tell everybody you're an MD, board certified in family medicine and board certified in integrative and holistic medicine, our fave on the Healthy Home Hour here. And you're fellowship trained at the American Academy of Anti-Aging, a master's degree in exercise physiology and cardiac rehabilitation. You're a member of the Institute for Functional Medicine, which we are really going to dig into, and as well as other stuff too. And on top of all that, you're a nutrition and exercise consultant for Studio Fit. And you look like you're ready to play for the Panthers. I mean, folks, he's fit, this doc. You should see him. What a handsome guy.
Thank you.
So, Dr. Woodward, it's so fascinating. How did you know, or how did you feel? Why were you called to go in this direction? What prompted you to skip being, an orthopedic surgeon or an oncologist, a cancer specialist, and to put your focus on the function of health, functional medicine? And so I guess tell us about that and help us understand, what is functional medicine?
Sure, you're right. Well, Holly, I started really with wellness medicine prior to going to medical school. So I started in health promotion as a health educator. That's when I got my master's in exercise science and cardiac rehab, and started working with people like Studio Fit to set up nutrition programs. How do we coach people into better health outcomes? And some of that was education, but some of it was really behavioral health coaching, which is now an integral part of our functional medicine clinic. But certainly I was really more into the exercise science, the nutritional science, which, by the way, we are not trained in modern medicine. So
it's incredible, isn't it?
Right, exactly. So through medical school, through residency training, you get about 7 hours of exercise and nutritional science training. So then to go out and implement a good program and deliver is a big piece, other than just reading it in a peer-reviewed article. So certainly I started training with from that piece, but I didn't have the medical background, so my influence wasn't quite the same as I would give good medical exercise nutrition advice, and then someone would come back and say, well, my family doctor or my internal medicine doctor may not agree with that. So that led me into pursuing a degree in medicine, and led me down the path of family medicine because I felt that's where I could make a big difference with preventive health care and implementing these pieces I learned from my wellness background. And so I actually practiced in the ER for about 8 years, and I still practice in the ER. I'm still an ER physician, so I'm still have my hands in the conventional circles. But what I was finding consistently, and why I didn't even pursue family medicine, is it was that conventional path, we're really kind of handcuffed to a system that doesn't allow us to practice good health practices with exercise science, lifestyle medicine, in other words. And so I pursued some postgraduate training in functional medicine through the Institute of Functional Medicine, the Metabolic Medical Institute, which is the A4M that you had mentioned. And you start to learn a whole new world of how to manage health and wellness better. And it builds upon some of the conventional training. So we don't ignore good conventional medicine, but we integrate functional medicine and conventional medicine, and we call that complete medicine. So we think that's the best approach. So, yeah.
That's so interesting. It's kind of a different route. That's a different journey than you hear about from your average MD. And I'm wondering, I mean, functional medicine, it's sort of a new term. Not everybody's heard about it. Is it similar to integrative medicine? Is it that combines traditional medicine with alternative therapies like Reiki or craniosacral therapy or acupuncture? Or is it something else?
It really is kind of a medicine of its own. And when some people ask me what is functional medicine, I would say, well, it's the opposite of dysfunctional medicine,
which we know about.
We know about that, right? Which is why a lot of people come see us, because I think some of the medicine they've been stuck in is a dysfunctional. They're on a dysfunctional roadmap, and I think functional medicine provides a different roadmap, and we look at medicine differently, and so. Yeah, we look at it through a series of multiple areas of dysfunction, whether it's immune dysfunction, gastrointestinal dysfunction, nutritional dysfunction, hormonal dysfunction. So we put all these pieces together, and really where functional medicine thrives is we network it all together. It's the medicine of connections. So we pull them together into one functional roadmap, as opposed to sending someone to 4 different specialists for the same underlying imbalance or dysfunction. And it really pulls it all together. And I think that's why the Institute of Functional Medicine and the Cleveland Clinic now have partnered and now are driving this functional medicine piece home through the Functional Medicine Institute and through the Cleveland Clinic. So Duke, Northwestern, Emory, all of these academic, 13 medical schools now have functional medicine as a part of their curriculum. 40 countries are now practicing functional medicine from the Institute of Functional Medicine. So this is mainstream. This is the future of medicine. Yeah.
That is so, everybody, you just want to go, oh, okay. Mm-hmm. At last, all that you're talking about, this medicine of connections, because so many people, myself included, have gone from doctor to doctor to doctor. Mm-hmm. Nothing really has happened. Nothing's improved. Yeah. And it's just been very expensive. Mm-hmm. So it's kind of, never mind suffering all the way through that time. So it's very exciting to hear you say that. And to talk about it more specifically, I've heard you speak of optimal wellness, and that's the way you're approaching health, and that's part of functional medicine. And I'm wondering, how is optimal wellness different from, how is that experience? What's the feeling of that versus just the absence of disease? Is there a difference?
Right. Yeah. No. Great question. Chronic medical diseases today is really where functional medicine answers that question. And what we find is that by the time you end up with a diagnosis of functional medicine, of a disease, of a chronic disease, you've likely had a lot of dysfunction going on for quite some time. For example, Hashimoto's hypothyroidism, for instance. If you have positive antibodies against your thyroid, those antibodies could have been present for 7 to 14 years prior to you having a diagnosis of hypothyroidism with abnormal thyroid blood values. And clinically, however, you've probably felt lousy up until that point, like you said, suffering along the way until finally you get the diagnosis that you can do something with. So yes, absolutely. I think there's a lot of what we call insidious dysfunctions that finally lead to the disease or the diagnosis, or the what do I finally have. And conventional medicine focuses on the what. What do I have? What pill do I now take to treat it? Functional medicine focuses on the why. Why do you have this disease? Let's go upstream and figure out where the dysfunction is and fix it. And then we really come to this realization that do diseases really exist, or do we just have a series of dysfunctions that we need to fix and correct? So sometimes we get people early on in that dysfunction cascade. So if we fix the dysfunction, the disease never shows up. Then you reach this state of optimal wellness. So if we fix the dysfunctions, if we fix the imbalances, you then arrive where your system's functioning well, your hormones are balanced, your immune system is not it's not on overdrive or underdrive for that matter, and you feel well. You're not suffering as much anymore because now you're on a path of true functional wellness.
That's an incredible concept that you just brought up, about that maybe there really isn't any disease. It's just a matter of no dysfunction.
Yeah. Yeah.
How does there's a lot of conversation now too about somebody's genetic makeup, and there's tests out there, 23andMe and all this stuff you can do. And how does that relate to genetics?
Perfect. Yes. I'm glad you asked that. The genetic testing, or what we call genomics, and this can turn into multiple areas. We can talk about this piece alone for quite some time, but it's definitely a piece. In fact, we test for genetic markers in our clinic. It's part of your overall, what we call a functional workup, because it's not just the lifestyle pieces. It's knowing how to support maybe some of your genetic markers that are creating some of the dysfunction. So we want to know what enzymes might you be deficient in, or what genetic predispositions do you have with disease. So what we want to do is we support that nutritionally and through lifestyle support. So yes, genomics can have an effect on your metabolism, on how your hormones are functioning, on how you absorb and digest nutrients. So genetics are a big piece, and it's important to know where you're at. In fact, I just saw a woman this morning who has what we call an MTHFR.
I wanted to ask you about that.
Yes. So very important to have tested. I think everyone should be screened for some of these genetic, what we call SNPs, SNPs, which is just an abnormal gene variant in your genome. So yeah, MTHFR, COMT, she happens to have both of them. Both of the abnormalities in her genes. So 30% increase in cardiovascular disease, increase in cancer rates, increase in depression and mood instability. She does not detox well in her system. She's on estrogen. She's not going to manage those estrogens well. So we want to support your body. And if you have some of these genetic problems, then we want to support them. And that's possible to do. It doesn't mean that she has to have a 30% increase in these diseases. We can minimize that and improve her risk scores. So, yeah.
That is fascinating and really sounds so promising and hopeful for folks. I'm so glad you're here, Dr. Woodward, to talk about these really exciting possibilities and hope. Really bringing hope. So folks, stay with us. We got lots to talk about here with Dr. Woodward right here today on the Healthy Home Hour, sponsored by the Healthy Home Market and your Streets 103.3. Get healthy at the Healthy Home Market, your locally owned natural and specialty foods grocery store. Try new Fresh Daily Hot Bar with meats, fish, and veggies. Cool off with fresh juices, smoothies, and banana whips. Stay healthy with the Healthy Home Market. You know it's true. Drink more water, eat your vegetables, and move your body and bones for real and lasting health. But which water and what foods? Do you find it hard to know what to eat these days? Get the help your body craves at the Healthy Home Market. Buy local farm to table foods to nourish your very selves with tasty goodness of organic natural meats and cheeses, produce, juices, and smoothies. And these days, everyone needs vitamins. Get the best and educate yourself with the highly trained vitamin staff at the Healthy Home Market. Learn how to restore your body from the inside out on a budget by shopping the extensive bulk department for nuts, herbs, cereals, dried fruits, mixes, and lots lots more. Experience the goodwill and bounty of the earth at the Healthy Home Market's 2 Charlotte locations and 1 in Davidson. Get details on the Healthy Home Market at healthyhomemkt.com.
Novocaine, baby, baby. Novocaine, baby.
Hey, we're back. I'm Holly Adams, your host, and we're here with Dr. John Woodward from EverVitalMD. You can check it out, in fact, and go online, EverVitalMD.com. There's so many cool things on there to learn about. There's even an online free hormone deficiency survey. That would be really a good thing to know about. But before we get back to Dr. Woodward, I do want to remind you that, there's some good things coming up at the Healthy Home Market. Thursday, December 3rd, there's a wonderful class on herbs from 6 to 7:30. That's in the Community Wellness Center, that's right behind, sort of at the back of the parking lot of the Plaza Midwood store at 1330 Central Avenue. And then coming up on a Tuesday, I think it's the 16th, I think I could be off on that, but I know it's a Tuesday and I don't have a calendar right in front of me, but get there or check it out online at healthyhomemkt.com. There's a continuing permaculture class that is fascinating. This is about the 5th installment of permaculture, but it's easy to jump right in on the class, even if it's your first time. It's 6:30 to 8, and it's such an education, and people who are really very caring and sharing about plants and how to manage water in your yards. They even come with plants, like they've pulled out of their yard and they're giving plants away for free. So check it out, the permaculture class. You can go to healthyhomemkt.com to know what we're talking about. So Dr. Woodward, before the break, we were talking about, you mentioned the mother gene, and you said something about if you have both mother gene. Is that meaning from your dad and your mom that you got it like double whammy, or what do you mean by that?
I'm sorry. It's there's methylation genes that I was referring to, and the two of the genes that we check several genes in our particular genetic profile. But one of the genes is called the MTHFR gene. Sometimes we call it the Monday, Tuesday, Thursday, Friday gene to make it simple.
Okay.
But and the other one is the COMT gene. And we look for defects in these two genes, and what these two genes really dictate is how well do you detox, how well do you, the word is called methylate. And some people out there may know what that means. But if you don't, methylation is an important process that we use to detoxify several things in our body, but it also keeps oxidative stressors low. It helps us manage inflammation. It also can, if we do have the defects in the genes, it can increase our risk of multiple pathologies such as depression, ADHD, autism, cardiovascular disease in particular, with heart disease and stroke, and certain cancers. So I think that identifying that up front so we can support that and you can push past the genetic predisposition.
So when you say the genetic predisposition, and you mentioned something earlier called the SNPs, the SNPs, SNPs, is that something you're born with, or does it express itself as a result of bad lifestyle habits?
Yeah, typically a lot of people are born with this. SNP stands for single nucleotide polymorphism, which just means one of the genes or one of the proteins in that gene sequence has been replaced with something else. So, and when that nucleic acid's been replaced, it changes the function of the gene, so it's not behaving like it should anymore. So the way we metabolize folic acid and certain things can really predispose us to some problems. But we can get around that by giving your body what we call methyl support. So if your body's not able to methylate well, I know that word sounds big, but it's really pretty simple, then we can provide you some nutritional methyl factors that can get around that process.
Yeah, it's so cool. It seems to be up in and about, because we have some products at the Healthy Home Market, one by Ultra Lab right now that's a whole series of vitamin Bs and having the folate versus the folic acid, I think it is, and it's down the line in some of their products, and of course the methyl B12. We've got it all Healthy Home Markets. I'm wondering, is this a bigger problem than we knew about? I mean, what's the percentage of Americans that should be thinking about this, that need to come see you and get this kind of solved or treated?
Great. Yeah, I think everyone should be screened for it, quite frankly. I think every functional medicine practitioner has screened themselves for it, and a lot more conventional physicians are starting to screen for it as well. Almost everyone who goes through pregnancy today is being screened for the MTHFR because of potential effects on the baby, potential increase in miscarriage. So absolutely, I think those are great products, and I think it's important for people when they look for those or ask somebody at Home Healthy Market to ask, hey, I'm looking for the methyl B vitamins, and because especially if you have the MTHFR that's been identified. So in the meantime, I would say if someone is taking a B12 or folic acid supplement, I would recommend a methyl B versus something else, especially until you find out. And we can do that for you at our clinic as well.
Right. There's it sounds like looking at the function of our bodies is really helping and supporting more like the natural rhythms, and you're talking about even genetics, and it makes a lot more sense than just chemicals or drugs, but sometimes drugs are necessary. How do you, as a doctor, how do you make that call?
Right. Because we are more of a holistic type clinic, and sometimes what that means is people bring in a whole list of problems, right?
Right.
So it's not just holistic, and so we tend to get people after they've been to a lot of physicians prior to ending up on our doorstep, unless they're kind of proactive about it. So yes, we take inventory. What medications, why you're on this, does it truly treat the dysfunction? Because a lot of these medications are blockers or inhibitors, or they're kind of the anti-meds, like a calcium channel blocker for blood pressure or an H2 blocker for reflux disease. Do any of these things really treat the underlying problem? The answer is usually no, and usually with some what we call collateral damage or cost involved. So, for example, if someone is on a reflux medication and they're taking an antacid, most of those people will be B12 and magnesium deficient, when those are already the number one mineral and vitamin deficiencies in our country. So we actually call drugs like this drug muggers. So because they mug the nutrients from our body. So already we're the most overfed, undernourished society, and now we use the most drugs in our society. So certainly, as an ER physician, do I prescribe medications at certain times, and there are certain meds that are good for us, especially if there's infections such as pneumonia? Absolutely. Or if our blood pressure is not at goal while we're treating the underlying physiology, yes. So what we'll do is we'll take inventory of which medications that people are on. If they support function, I'm okay with it. If most drugs out there, however, don't. They're the antis, the inhibitors, the blockers.
Right.
So what I would recommend then is we would correct the underlying dysfunction and then slowly wean someone off of the medication in conjunction with their primary care physician and or their specialist. So we certainly pull the whole team together when making those decisions.
Right. It's amazing if you spend any time with the TV on at all, it seems as though 80 to 90% of the commercials are on about drugs. So they start out with everything's really happy and everybody's smiling and they're feeling better, presumably because of these drugs. And then further down the line in the commercial, you get a side effect list that reads like, a gigantic menu of some sort. But people, they're still smiling in the pictures. And so it really is, you talk about the drug muggers. That's a great expression. I'd never heard that before. And just all the side effects that do happen. And you found with treating people through functional medicine, I bet over time, people must come in with, I have a friend who takes 30 medications a day.
Unbelievable. Right.
Do you find that over time they're down to one or two? Or
Absolutely. Yeah, I would say most of the people who enter our program leave on less medications than they started with. And that includes diabetic medications. I truly believe that you can reverse diabetes A lot of these medications are not designed to fix the underlying insulin resistance problem, particularly for type 2 diabetes. But our type 1 diabetics are on half or a third of the insulin that they were on when they started. So, you go into the blood pressure medications is another common one that we try to get people off of. The reflux medications, these GI medications. So what I'll say is this, when you look at dysfunction in meds, is that depression is not a Prozac deficiency, and cholesterol elevation is not a statin or a Lipitor deficiency. We can go on and go through it all, but it's going after the dysfunction and applying the right physiology, genetics like you talked about, and the right coaching support to correct that physiology and the correct dysfunctions, and systematically take them off of meds safely. So we require blood pressure diaries and blood sugar diaries to make sure this is done appropriately. So, of course, today's call, no one should stop medications abruptly without the consult of their physician. But without a question, and there's a criteria out there called the Beers criteria, just recently updated in 2015 from the American Geriatric Society. And what the Beers criteria says is after 8 medications, the chance of drug-drug interaction is 100%.
Wow.
Yeah. So do we really know how effective any of these meds are when we take them together? Because they're not studied that way. They're studied with one drug at a time. And like you just said, the side effects, the possible benefits. I'm now taking a drug for the drug. I'm now taking a nausea pill because the drug that I take for something else causes the nausea, and I'm now taking a dizzy pill for the drug that causes that. So I think that we're on a list of medications for the side effects of a list of other medications. So certainly, in a holistic, integrative functional clinic, our goal is to treat this naturally, and we go back to the laws of biology and fix it that way. And functional medicine is entrenched in good evidence-based biology. So yeah.
That's so fascinating. We're going to keep talking about that. We're going to take another short break, folks. Keep it locked right here on Streets 103.3.
Get healthy at the Healthy Home Market, your locally owned natural and specialty foods grocery store. Try new Fresh Daily Hot Bar with meats, fish, and veggies. Cool off with fresh juices, smoothies, and banana whips. Stay healthy with the Healthy Home Market. You know it's true. Drink more water, eat your vegetables, and move your body and bones for real and lasting health. But which water and what foods? Do you find it hard to know what to eat these days? Get the help your body craves at the Healthy Home Market. Buy local farm-to-table foods to nourish your very selves with tasty goodness of organic natural meats and cheeses, produce, juices, and smoothies. And these days, everyone needs vitamins. Get the best and educate yourself with the highly trained vitamin staff at the Healthy Home Market. Learn how to restore your body from the inside out on a budget by shopping the extensive bulk department for nuts, herbs, cereals, dried fruits, mixes, and lots more. Experience the goodwill and bounty of the earth at the Healthy Home Market's 2 Charlotte locations and 1 in Davidson. Get details on the Healthy Home Market at healthyhomemkt.com.
Novocaine, baby, Novocaine, baby.
Welcome back. You're listening to the Healthy Home Hour, sponsored by the Healthy Home Market with 3 stores, 2 in Charlotte and 1 up in Davidson. And in fact, our guest, Dr. Woodward, his team actually does store tours at our Davidson store right there on Griffith Street, right near the Davidson College. You can't miss it there. There's a movie theater there right in that little shopping center. And I want to just let you all know that if you're thinking about something to add to your turkey as well when you're in the Davidson store or the 2 stores in Charlotte, that I'm told that by our wine and beer meister at the Healthy Home Market, that Sauvignon Blanc and Chardonnay go great with turkey and ham. And I can recommend a couple to you. There's La Playa Sauvignon Blanc, 2015 vintage. It's only $11.49 a bottle. Maybe a little pricey for some, but as far as good wine goes, that's a great deal. And then there's also something called Educated Guess Chardonnay, 2013. That's $17.99 a bottle. That's a big, nice present for somebody. And then as far as beer goes, there's Green Man Porter out of Asheville. That's $10.99 for a 6-pack. And Sierra Nevada Celebration Ale, a fresh hop IPA at $9.99. So there's some options to go along with your holiday table. You know, Dr. Woodward, one of the things you mentioned earlier on towards the top of the hour was Hashimoto's, and I know that relates to thyroid. That's an autoimmune issue for the thyroid, and how it sometimes takes 7 to 14 years to show up in the body. I have read and learned that there's something like 70% of the American population has an issue with their thyroid. And I'm wondering, there's also info out there that talks about petrochemicals and the plastics affecting our thyroids, and that maybe we should stay away from plastic bagging up of everything. We should have glass bottles. And what do you say to all that?
Yeah, I mean, great timing on your question, too, because the American College of Endocrinology, the American Endocrinology Society, just a couple weeks ago, finally addressed this concept of low-level toxicity in our environment and how it impacts our endocrine system, our hormone system. And so they're acknowledging this concern of endocrine disruption. These chemicals behave and bind to the same receptors that these hormones do in our bodies, so they interfere the function. And not just that, but they also turn on our immune system, is what part of the concern is as well. Now, this is me speaking, not the Endocrine Society. However, if we're turning on this immune system, and women who have hypothyroidism, 90% of them, it's predicted, have an autoimmune hypothyroid condition. So 9 out of 10 women likely should be screened for this autoimmune concern. And certainly toxins in the environment, these low-level toxins that we never really addressed over time, can be turning on this immune cascade that eventually attacks our thyroid gland, because our thyroid doesn't look the same when it has a certain chemical attached to it. It now looks foreign to us, whether it's a plasticizer or BPA that some people have heard of. That's the waxy coating that lines our Starbucks cups and all kinds of Campbell's soup cans and things. So it's BPA is very pervasive. It's used in a lot of things today, but it's a known endocrine disruptor, as well as things like phthalates, and that's PTH phthalates. And that's an androgen blocker. Androgens are things like testosterone and DHEA. So plasticizer phthalates are the plasticizers that makes our plastic water bottles real soft and pliable, or any plastic soft and pliable. And so certainly, those are two real common ones that are looked at today in terms of how much of the toxic exposure relates to endocrine disruption. But definitely thyroid disease is a significant problem. When you mention percentage, I think it depends on who you ask. Some people will tell you that it's 10% of the population, based on maybe some of the endocrine society remarks. However, I'll tell you that the people I see in my clinic is upwards of around 50%, based on how I would evaluate them functionally, which may be different. So I think we do dinner talks on thyroid, and we do talks, and that's one of our areas of where we believe we specialize in. And our ad says, do you still feel lousy, but yet you're told your labs are normal?
Right. I mean, so many people say that. I hear it every day at the market. And so people are coming in to try to feel better, even though they're trying everything they've been told to do.
Yes. And I think there's we do a functional thyroid workup, which is a panel of about 7 or 8 items, not just a TSH. So if you feel like you want a better look at that thyroid panel, seek out a functional medicine doctor that might look at that differently. And it's certainly at EverVitalMD, we're one of those people. So,
Well, and I want you all to know that right now, as a Healthy Home Hour listeners deal, there's an initial consult for just $89 with Dr. Woodward, so you can check out that kind of, well, just exactly what you just said about the special functional thyroid. Because, man, I have been to doctors about my thyroid, and it's been really not helpful, to be honest with you. I've still got some thyroid issues that should have been resolved. So I got to come talk to you.
Yes.
It's the thyroid too they call it the master gland, right? And it affects so much. Do you find that when you're working with people with thyroid issues, that other body systems and organs are compromised or involved, and that they can improve? Like, I know there's this relationship that's very significant between the thyroid and the adrenal glands.
Mm-hmm. Yes, absolutely. What I tell people, exactly what you said, Holly, is if the adrenal glands have not been assessed up front, that should be part of your thyroid evaluation. And the two hormones that we typically look at up front from an adrenal standpoint is cortisol and DHEA. And what we typically say is cortisol is this stress hormone that can impact multiple areas of all your other hormones, but particularly thyroid. And certainly it can affect the brain where thyroid's released. It can affect the thyroid gland itself, and then it can interfere with thyroid peripherally where it attaches to all cells. So the common question is, well, where does thyroid work in the body? And the answer is, frankly, it works in every cell in the body. So if I have constipation, if I have GI gut disturbance, if I have, depressive symptoms, it works in my brain. If I have blood pressure that's not well controlled, if I have other conditions. So all of a sudden, the underlying problems, hypothyroidism, because it hasn't been evaluated correctly. And now I'm on 7 new medications for blood pressure, for my gut, for my depression. And yet we never really address the underlying dysfunction. And this is where functional medicine networks it all together and answers the fundamental question.
There's also, of course, everybody's concerned with being trim and slim and gorgeous. So there's this big connection between the thyroid and weight. What do you notice when people get their thyroid straight?
Yes, I would say this. I'm pretty conservative with, how much weight someone would lose once we dial their thyroid in. Now, of course, when someone's thyroid labs and numbers and their clinical symptoms are very out of whack or out of balance, what I would say is those people certainly can find a big difference. The difference between, let's say, if people are familiar with a TSH of 0.4 compared to 4.0 is 12 pounds. So,
wow.
And that's all within a normal TSH range. That's within the normal reference range. So sometimes I tell people, if you're at a TSH of 4, why not have you still in the same normal range and have you at 0.6 or 0.7, and potentially that's the 10 pounds that's been hanging on for so long. However, we don't approach weight management at EverVital with just thyroid evaluation. We certainly integrate multiple other things that correct underlying dysfunction and support good health and weight management. Yeah.
Sure. And when you say TSH, you're talking about the thyroid stimulating hormone.
Yes.
And that when you say the normal range, you're talking about conventional, traditional medicine says that's the normal range. But in functional medicine, it's maybe not?
Yeah, I'm glad you brought that up. In functional medicine, we definitely look at functional ranges a little bit differently. And thyroid is one of those that we veer from the conventional kind of reference range that someone would see on their labs. So we do spend a little bit more time focusing on the free hormones in thyroid, not the TSH. However, we don't ignore the TSH. We still take that into account. So we look at the whole panel, but free hormone levels tend to really reflect how someone feels, whether it's weight gain or whether it's cold hands and feet or depressive symptoms or gut dysfunction or GI problems. So we certainly dial in, and most of my treatment is focused on the free hormone levels as opposed to the TSH. But I certainly don't see why someone couldn't be at a 0.7 when they don't feel well, versus the 3.8. Now, if they feel well at 2.5, then that's okay. That's the right dose. That's the right place where they need to be.
Which is so interesting because it's where right place where they need to be,
Yes.
rather than how they fit into this bell curve that everybody's supposed to look this particular way. And that's what I find fascinating about functional medicine. The other thing that I think it's something like 85% of Medicare costs are as a result of chronic disease. And diabetes is a big one. And with functional medicine and this big buffet of health solutions we're talking about today, you even said it a moment ago that you can actually reverse maybe type 2 diabetes and do something to affect type 1 diabetes?
Absolutely. And again, going back to mechanism medicine, functional medicine, looking at the root cause, the why, not what they have, but why do you have this dysfunction? And I believe even the American Diabetic Association, I think, could be better with this, could be more clear on this. We still focus on blood sugar. We don't focus on insulin. And so we need to focus on the insulin level. So we get very sensitive with our testing for diabetes at our clinic. More sensitive, I think, than kind of a lot of conventional therapies. So we use conventional therapies, but we also add some sensitive markers, biomarkers is what we call them. But fasting insulin levels are significant. If we correct that piece, definitely diabetes is reversible. I just want to take a step, just because you just mentioned it, in terms of how we're really kind of losing the battle. Modern medicine, lifestyle is now caught up with the technological advances of modern medicine. It's the first generation that we're raising today that is predicted to not live as long as their parents. 1 in 2 will have cardiovascular disease. 1 in 3 of the children born in the early 2000s will have diabetes. 1 in 4 with depression. Dementia is accelerating. Several cancers continue to increase. Lots of glandular cancers, including thyroid, is the most rapid increase cancer currently out there in terms of growth rate. Autoimmune diseases, 300% increase. So I gave lots of examples there, but my point is that with modern medicine and our conventional approach to these things, we're losing ground. We're not gaining ground. In the functional areas, we're gaining ground if we treat it functionally. So diabetes is one of those areas. Autoimmune disease is one of those areas that, yes, I do believe we can reverse it. I didn't say cure it, but reverse it. Our type 1 diabetics, their pancreas may not be working anymore to secrete insulin. But if we correct your body at the cellular level that insulin has to act on, your body needs less of it. So then you need to inject less of it, or your pump needs to secrete less of it. So that being said, yes, I think there's a continuum of disease and we can reverse it and improve. And of course, when you improve your diabetes, you decrease your risk of blindness, amputations, cardiovascular disease, neuropathies, lots of quality of life markers that we're invested on helping people improve upon.
That's very exciting. Truly. So, don't go away, folks. We got more to talk about with Dr. Woodward. This is so fascinating. And I hope you're enjoying your Sunday, and we'll see you shortly. Don't go anywhere.
Get healthy at the Healthy Home Market, your locally owned natural and specialty foods grocery store. Try new Fresh Daily Hot Bar with meats, fish, and veggies. Cool off with fresh juices, smoothies, and banana whips. Stay healthy with the Healthy Home Market. You know it's true. Drink more water, eat your vegetables, and move your body and bones for real and lasting health. But which water and what foods? Do you find it hard to know what to eat these days? Get the help your body craves at the Healthy Home Market. Buy local farm to table foods to nourish your very selves with tasty goodness of organic natural meats and cheeses, produce, juices, and smoothies. And these days, everyone needs vitamins. Get the best and educate yourself with the highly trained vitamin staff at the Healthy Home Market. Learn how to restore your body from the inside out on a budget by shopping the extensive bulk department for nuts, herbs, cereals, dried fruits, mixes, and lots lots more. Experience the goodwill and bounty of the earth at the Healthy Home Market's 2 Charlotte locations and 1 in Davidson. Get details on the Healthy Home Market at healthyhomemkt.com.
Novocaine, baby, baby. Novocaine, baby.
We're back. Glad you're here. I'm Holly Adams, your host. We're here with Dr. John Woodward of the EverVitalMD. You can check it out, evervitalmd.com. You can actually take a survey, a free online hormone deficiency survey. And our conversation, wow, we've been talking about thyroid and adrenals and how the hormones, the glandular system is so important. You mentioned, Dr. Woodward, about even the endocrine society has come out recently, very recently, and said something about the level of toxins and toxicity is affecting the markers within our system that would ordinarily be filled with hormones, but they're getting filled up, or that lock and key relationship is being, and we were talking about diabetes before the break. And there's so much conversation about insulin resistance now and leptin and all that. Can you tease that out a little bit for us? Because not everybody understands that, including me.
Yeah. Diabetes, I think, and I think if you were to approach diabetes functionally like we do, there's multiple pieces that have to be put in place to actually move in the direction of reversal of disease, particularly for type 2 diabetes, because that's really more of the insulin resistance. Insulin resistance exists for both type 1 and type 2 diabetes, and we even have there's kind of a in-between diabetes where you can get autoimmune diabetes at an older age, and we can check for those antibodies if that happens. So not all type 1 diabetics are diabetics from childhood. You can get a type 1 autoimmune response later in life as well, and so sometimes there's a little overlap with these diabetes. However, really, again, when I talk about biology, functional medicine, we look at cellular medicine, and there's receptors on the cells that insulin reacts to. So what we want to do is we want to impact your sensitivity to insulin on those cells. That's what really gets at reversing the disease. Unfortunately, our conventional approach is giving you meds that give you more insulin. So you'll secrete more insulin to drive more sugar into the cells. Well, let me just say this. Sugar in cells can be toxic. Your body doesn't want more sugar in its cells, and that could be damaging. It could age the cell prematurely. It can cause dysfunction to the cell. It's toxic to the cell. So, however, we keep giving more medicine to drive more sugar into the cell, whether we're giving insulin or whether we're giving medications to secrete more insulin in your own body.
Wow.
And that's part of the dysfunction. So really what we need to do is modify the diet to decrease the insulin response, not modify the drug to affect the insulin response. I think we have that backwards. And I don't think most physicians would not disagree with that. However, when you're faced with certain numbers, we treat numbers, and the primary treatment tends to be the medicine. The adjunctive treatment tends to be the lifestyle, and I think it needs to be reversed. Our primary treatment really needs to be the lifestyle piece, aggressive diet therapy with good coaching support and specifics, not just a general idea. I think people already know they need to eat less sugar and less carbohydrates when you're diabetic. Easier said than done. It's simple but not easy, right?
Sure.
So I think that we need to trick the cell. We need to get the cell to express more receptors for insulin so we manage the insulin and the blood sugar better. And to do that, the best way to do that is with diet therapy, regular exercise. There are certain supplements out there that support this sensitivity. So kind of a complex mechanism, but trying to boil it down into increasing insulin is not the answer.
Yeah, it's so interesting because this whole diabetes thing. There's so many layers to it now. There's conversation and things written about how there's actually even a diabetes type 3 that's affecting the brain, and how it's you mentioned earlier about how dementia is rising and Alzheimer's is on the rise. And do you think that the sugar is affecting our memory and our neurological health?
Yeah, great. I'm glad you mentioned dementia and blood sugar. Dramatic increased risk of dementia when blood sugar metabolism is not in alignment or out of balance. So so someone comes into the clinic with concerns of dementia. Well, there's multiple things, multiple underlying etiologies that can be causing that, whether it's a B12 deficiency or a heavy metal toxicity or one of these low-level toxins that we just spoke about that might be disrupting a cascade of events. But blood sugar rapidly accelerates the aging process, particularly in the brain. So there's a strong correlation with blood sugar metabolism, diabetes, and increased risk of dementia. So if anyone is concerned about dementia or has dementia and trying to maintain and hang on to some cognitive memory, blood sugar is the first thing to attack. And among other things at the same time. I don't think you should attack one thing at a time, but blood sugar's correspondence with dementia is significantly important, yes.
So would you attack blood sugar? Like, what could somebody do today after we've just had pecan pie and, all the sweet stuff and the mashed potatoes and everything over the course of this weekend? What would you recommend people do before they can get to see you for that, great initial consult, that $89 charge that's so reasonable to come see you? Like, what can you stop doing now? Obviously, Coca-Cola and, another piece of bread pudding or something, but there's some hidden things. It's hard to get rid of it all, isn't it?
It is. I mean, we have a meal plan, we have recommendations, but our diet plan that we recommend, and there's lots of recipes, lots of information on the internet about this to kind of guide you and help you before you were to come in, to where we fine tune it and personalize it to you. Is what we call a paleo-Mediterranean diet. And the paleo diet tends to be a low-carbohydrate diet. So we're not strict paleo diet. So we call it the paleo concept or the paleo-Mediterranean concept. So again, limiting carbohydrates is the key here. That's going to decrease your insulin response. Insulin's the problem. So if we limit carbohydrates, and typically when a diabetic is trying to reverse their disease, they need to keep their carbohydrates under 100. So how do they do that without complex measurements and things? There are some apps out there on your phone that you can download that you can track your behaviors over time and take a look at that, and we can guide you through that. But if you are keeping your carbohydrates under 100, you're going to decrease your insulin. You're going to reverse your disease. Now, there's other things that I would, in addition to that, daily activity. So exercise is significant, even if it's 5 minutes a day, which is the minimum. That's all we ask people initially, 5 minutes. Some people think we're going to get you involved in this extensive exercise program right from the beginning. No, we just want you moving your body through space. We just want you taking steps, because you can take sugar and put it into the cell without insulin just by walking. So you turn on these mechanisms again to help your blood sugar metabolism. And then your body does not have to secrete insulin when you turn on mechanisms like that. So certainly those would be the two easiest lifestyle behavior things to do: daily activity, limiting carbohydrates right up front. Certainly you said, high calorie soft drinks, sugar soft drinks. Certainly that would be, within 2 soft drinks, you're at over your carbohydrate intake for the day. So it's very, very easy to get there quickly.
Right. How about leaky gut? Because that is a big topic of conversation now. Leaky gut and celiac and its connection to autism, and again, that gut-brain connection.
Yes. Yeah, great topic. And this is the hotbed topic right now in functional medicine. This is exploding with new literature, new guidelines. And most functional practitioners out there are very aware of Dr. Fasano's work from Harvard with identifying these proteins that get dysfunctional and cause what we call leaky gut syndrome, or what we call gut permeability syndrome, which is our gut wall is a single cell layer thick. So when those cells are not held tightly together by these proteins called tight junctions, they leak, and they can leak certain proteins through them. And what's on the other side of that gut wall layer is the immune system. And when the immune system gets a hold of these proteins that they don't recognize as broccoli anymore or chocolate anymore, They cause an immune response. And anytime you have an increased response with your immune system, you have inflammation. So leaky gut equals inflammation. And what we say in the functional world is leaky gut, leaky brain. So this gut-brain connection is certainly, and certainly there's a lot of case studies on here about leaky gut, but people that have gone gluten-free no longer have evidence of multiple sclerosis plaques in their brain anymore. So it mimics, these inflammatory plaques in the brain mimic some of these neurodegenerative diseases. Leaky gut can impact multiple areas of the body as it expresses itself in inflammation, eczema, rashes, and then sticking right in the gut itself. Certainly gluten is a big one.
Right.
And gluten, without a question, Dr. Fasano from Harvard would tell you that everyone has an inflammatory response to gluten. It just depends on the severity of the response. So some people have a condition known as celiac disease, where they have significant damage to that single cell layer. And that can cause malabsorption issues, nutritional deficiencies, and multiple other problems, abdominal pain. Some people have something called brain fog, or just general increase in arthritic complaints, joint pains. So this gluten sensitivity, this non-celiac gluten sensitivity issue, can manifest itself and express itself in multiple ways. In fact, it's predicted that people who have a gluten sensitivity, 6 out of 7 of them are not GI related. They express themselves in other areas of the body, like the skin or the joints, or triggering an autoimmune response such as thyroid disease.
Wow.
Yeah, gluten is, I think, a bigger problem than we're willing to address at this time.
Yeah. How about, everybody's, in fact, this week, the FDA came out and said that genetically modified salmon is okay. And of course, there's all kinds of grassroots efforts to try to get foods labeled as such, as GMO. Do GMOs, would you say that they have an effect on the leaky gut? Do they exacerbate a leaky gut?
We believe they do. We believe they do at EverVital. We really hold the position with things like GMOs and artificial sweeteners, and these are still pretty contentious topics. And the conventional world is waiting for a robust amount of literature to say, you need to prove that that's harmful before I'm going to recommend not using it for my patients. In Europe, they hold to the mantra that if it's potentially harmful, we will remove it from the market until you prove that it's safe.
The opposite.
The opposite. Where in America, prove it's harmful, and before we remove it from the market. Where in Europe, they say prove, if it's potentially harmful, we will remove it. You don't have to prove it. So. Absolutely. That's why they don't advertise medications on TV like they do here in America. But certainly, I think GMOs can play a role with leaky gut.
And one of the other big things that people complain about is sleep. I wonder how many folks you're helping through functional medicine with sleep.
Such a common complaint.
Yeah.
In fact, what I tell people is we need to get you sleeping better right away. So many other things. I mean, dramatic increases in breast cancer and cardiovascular disease with improper sleep habits. So one of our first goals certainly is to attack this, to increase hours of sleep at night, and certainly get into the restorative deep levels of sleep, the stages 3 and 4 in sleep that most people know of. So our hormones are out of balance if we're not sleeping well. Our restorative hormones do not replenish themselves. So absolutely. And very commonly, cortisol is elevated when we have improper sleep because we're stressed all the time. So,
and that goes back to the thyroid again, and that we talked about at the beginning.
Yes. Cortisol interferes with sleep. It interferes with the thyroid on multiple levels, and it also causes leaky gut that we just spoke about. So cortisol is a key player in all this process and very important marker to have measured as part of an overall workup.
And of course, cortisol, too much cortisol, or eventually not enough cortisol, if it gets completely burnt out, is as a result of stress. So you would probably talk about, I mean, what do you tell people about stress? Because it's tough to get rid of.
It is tough to get rid of. It's not easy to get rid of. So certainly we certainly recommend multiple stress reduction strategies. However, if we reduce the stress on the body through reversing diabetes, through functionally fixing a thyroid where you now have energy again, you're losing weight again, you're now able to sleep because you're engaged in activity again. So certainly there are specific things that we can do to help moderate and suppress cortisol or support cortisol production if it's too low. So there are certainly ways that we can put together a treatment plan in and around adrenal thyroid function.
Yeah, and don't you have some classes coming up soon? Didn't I hear that you've got some thyroid classes in the next month or so?
Yes, we have a dinner talk.
Yeah, a dinner talk?
Yes, we have a dinner talk for thyroid. Where it's a free dinner as well. Free dinner. It's at one of them is at Alton's Steakhouse in Cornelius, and the other one is at Jeffrey's. So it's on December 1st and December 9th. So you can call our office and to go ahead and call and sign up for that talk. We provide you with a meal, and we let you know what we believe is the optimal treatment for thyroid management. So if you're still struggling with those things, your labs are normal, but yet you're still struggling with lots of thyroid dysfunction, then please consider attending the talk. I think it would be very helpful to you.
Excellent. And just so that you folks have it, give Dr. Woodward a call or his staff at 704-663-2091. That's 704-663-2091. And of course, check it out at EverVitalMD.com. I guess another question I would have that I think some folks might be having is, do you take insurance or Medicare? Is there any possibility of that?
Yeah, I'm glad you asked that question. In functional integrative medicine, unfortunately, insurance does not pay for functional integrative medicine. So what we say is we would love to take it. We hope someday that they will eventually support what we believe is the future of medicine, which I believe they will eventually. We do take insurance for a lot of lab work. Not all the lab work, because some of the lab work is not conventional labs, like some testings for cortisol that we just mentioned. But certainly what we say to here's how I kind of answer that question is, when you sign up as a provider with an insurance company and you sign on to be onto their network, you then are subject to how they want you to practice medicine. So if I need a full hour, which you get, by the way, for that $89, is a full hour of my time, bring in your lab work and fill out this introductory sheet that we have, I'm going to give you an hour. Insurance would never pay for that hour for functional wellness or integrative care or reversal of disease. So we don't want to take that away just because insurance doesn't cover it. We want to offer you the best optimal, natural, integrative, functional care. So I don't want them telling me what labs I can order and cannot order for you if they're critically important to diagnose and help us treat the why, if you will, and what's going on with your current concerns. Yeah,
it makes so much sense, because otherwise everybody is subject to the insurance companies. Mm-hmm. And then it ends up that the insurance company is actually running your medical care and your health or lack thereof. But you did say that many of the labs are covered, even with Medicare. So that's a big help.
Yeah, the bulk of them are covered for sure. Mm-hmm. And, in the conventional world, what I want to say is that, the conventional doctors, just because the average physician visit is 7 minutes doesn't mean that that's really what the physicians want to give you. I do believe the intentions are, if they could give you more time, they certainly would. However, in the conventional circles with reimbursement, it's a volume-based system now, so they have to crank more patients to bring in the dollar based on reimbursements. So, our goal is to give good functional care, and if the insurance business was dictating how we did that, there would be no functional medicine, unfortunately, as it exists today.
Right.
So, I think that that's to answer it in a nutshell. I'm hopeful to take it someday when they come around and they're able to reimburse for it.
I think they will. I mean, all roads are pointing towards that, between, what came out with the endocrine society this week, and looking at the toxins and what's going on with the food and the GMOs, and it goes on and on and on, and it's just, in the long run, it's so much more expensive to do it the traditional conventional way than to just do it right from the get-go.
Absolutely.
So I thank you very much for being here, Dr. Woodward. It went too fast. You'll have to come back. We've got lots more to talk about.
Sounds terrific. Thanks for having me.
Absolutely. My pleasure. So, folks, EverVitalMD really offering what I would say is the best of East and West, and traditional and integrative and functional, putting it all together. So for all you listeners today, there's a deal out there. The initial consult is just $89 for an appointment with Dr. John Woodward. Really a good deal by any measure. So check it out. Go to EverVitalMD.com. The number is 704-663-2091. That's 704-663-2091. And of course, check it out at EverVitalMD.com. Pay it forward and restore yourself by making the healthy choices for you and your family, and enjoy life with the Healthy Home Market. Feel the goodwill and own great health. Check it out at HealthyHomeMKT.com. That's HealthyHomeMKT.com for store locations, details, and discounts. Get the best of God's green blue earth at the Healthy Home Market.